So at this time, I would like to welcome our members of the media and those viewing the live stream to today's press conference with representatives from the Blue Ridge Health District. We are scheduled to begin at 2 p.m. My name is Lasheen Parks, and I'm with the city's communications office. We are hosting the Zoom webinar, and I'll be moderating today's Q&A with our credentialed media in attendance. Just a few notes before I hand it over to Kathryn Goodman, the Blue Ridge Health District's Public Relations and Communications Manager. After the presentation, we'll give each media member 2 opportunities to ask questions, and both opportunities will include your initial question and 1 follow-up question. As always, please keep your questions respectful and thoughtful for all of our participants. We appreciate your participation. And with that, I'll hand it over to Kathryn Goodman.
Technology. Thank you, Lasheen, and thank you to the City of Charlottesville for assisting us with hosting this press conference. I'm joined here today with Ryan McKay, who is our incident commander for our COVID-19 response in the Blue Ridge Health District. And Lasheen, we are ready for the PowerPoint presentation.
Okay. Can you guys see this?
We can, if you want to make it bigger.
Yeah, let me figure out how to do that.
Make it your full screen. So I'll at least get started today with letting folks know that we have a handful of updates to share. We will be talking about our vaccine supply. Perfect, Lasheen. If you want to make it even larger, Lasheen, you can. We can see your sides. It's up to you.
I don't know why this is not working.
Technology, it's been a long year. You'd think
it has been a long year.
Great. You think that we would all be great at technology at this point, but there's still things to learn. So this is fine. We'll get started. Okay. So here's just an overview of what we're going to be talking about today for everybody to be aware. We have some great updates to share regarding our vaccine data for how many people have been vaccinated, and also our allocation and supply of vaccine, which will be increasing pretty significantly next week. We will talk about VAMS, the Vaccine Administration Management System, and second dose appointments, and then also discussing our moves for phase 1C. So I'm going to pass it over to Ryan now for the next few slides.
Thank you, Kathryn, and thank you everyone for joining us today. Doing a start, it's been really just over 3 months, maybe 3.5 months since the vaccination campaign began, first with our healthcare systems in the health district, and then in January, when we began as a health district, really vaccinating in earnest members of the community in phase 1A. And so these are numbers that are located on the VDH website. There's a vaccine summary page that we've pulled this information from. It's updated daily. And so as of yesterday, you can see our totals here by county and locality, and then what we've done for each particular dose, first, second dose, and then total administered. So through the first 3.5 months of the vaccination campaign, nearly 90,000 people, adults, have received their first dose. We have 135 total doses administered. And then as you can see, there's 49 or almost 50,000 people who are fully vaccinated in our health district. We do know that there's approximately 200 to 205,000 individuals 16 and above who technically will be eligible at some point to get vaccinated. So we still have a ways to go, but I think it's important for us to share with you and to remind ourselves of where we are at this point in the vaccination campaign. One thing that we would expect is that based on the number of individuals who've received the first dose of Pfizer or Moderna or not the second, we would anticipate that the number of people who are fully vaccinated will increase by about 30 to 35,000 over the course of the next few weeks. Obviously, that doesn't include any sort of Johnson & Johnson vaccine that's administered, but we will see a significant increase in the total number of people fully vaccinated here in April and again in May. Next slide, please. As Kathryn mentioned, we are going to see a significant increase in doses beginning April 5th. This is something that we've anticipated based on information that VDH has provided. I think maybe our increase is a little bit more than we anticipated. So if we were to take the total numbers here, we're somewhere around 17 to 18,000 total doses that are going to be made available to the health district, whether that's us as the health district or specific to UVA working out of Seminole Square and in a lot of our community sites. So this increase does not include Johnson & Johnson. We do anticipate there's going to be a significant increase in those doses allocated to us next week, and we'll know more probably by the end of the day tomorrow of what that will be. So this really presents a wonderful opportunity for us to really increase access to the vaccine beginning next week. Obviously, we have an increase that came through this week. There are 4,000 doses of Johnson & Johnson that we're administering between tomorrow and Monday at the JCPenney location in Charlottesville and other locations in the district. So we're beginning to see that significant increase that we need in order to move much more quickly in the vaccination campaign. Next slide, please. So in order to get registered for an actual appointment, we have to remember to get registered in VAMS. We have been uploading names and email addresses, making phone calls to individuals who prefer phone calls to make sure that people who are eligible in 1B and eventually 1C can get appointments, and making sure that individuals have that opportunity before we need to move into phase 2 in the coming weeks. So just as a reminder, an email from vams@cdc.gov will be sent to your email address, and you can see a little bit of a screenshot there of what that email is going to look like. We are inviting people to participate and use this in all of our clinics as a way for us to better control who has access to the appointments, who has access to the system, and then making sure that we're going to vaccinate 1Bs and 1Cs, those who are at higher risk, before we move into phase 2. Now, a couple of things. If you registered in January for the VAMS platform, that invitation still works, and you can still access the platform in VAMS using the email account that you originally registered with. You may need to reset your password, which is pretty simple to do in the platform, but that's something that you should be able to access right now if you receive that registration in January. And if you're new to VAMS, when you get the invitation via email, you'll need to create and wrap up finishing your account, and then you can go in and register for appointments throughout the district in any of our clinics. And when can we do that? Well, individuals in 1A, 1B, and 1C can do that right now. And obviously, if there are issues accessing VAMS, if you're having problems locating the clinics or the sites, you can contact our hotline or email us at our Gmail account. Next slide. All right.
All right, thank you. And I will just mention as well with VAMS, all of the second dose appointments that were previously scheduled for our Kmart site, which is now closed, have been moved over to the JCPenney site. And those individuals should, in order to expedite their process when coming on site to get their second dose vaccine, we're encouraging them to schedule the appointment in VAMS. And if they haven't already received that information, they can reach out to us by calling or emailing us, but hopefully they should have that by now. So, as Ryan mentioned, who can schedule appointments right now? The Blue Ridge Health District has officially launched today into phase 1C of our vaccine distribution. So this includes, as you can see, all of the individuals pictured here, everyone from restaurant workers to finance workers and other public figures and public works individuals throughout the community who are really important for our community to continue operating. So we are opening up to phase 1C. We want to make sure that everybody has the opportunity to schedule appointments. And so the VAM system has many appointments available over the next 2 months. There are plenty of appointments that we want people to get in there and schedule. As Ryan shared, our vaccine supply has increased. And so we have plenty of appointments that we want people to schedule. Additionally, as the governor has shared, we will be moving into phase 2 by April 18th. And phase 2 is everybody in the community who's over the age of 16 that's eligible for a COVID-19 vaccine. So right now we are opening today to phase 1C, and in a few short weeks, we will be opening to phase 2. Individuals in phase 1C will receive invitations soon to schedule appointments through the VAM system. Again, it will be via email, or if individuals who had pre-registered in the state system listed that they would like to receive a phone call as their main method of scheduling an appointment, they will receive that phone call within the coming week. The next slide, Lasheen. All right, so as we are increasing vaccines throughout the community, it's important that we still remember all of our mitigation strategies. COVID-19 is still here and still spreading in the community. And as we head into Easter weekend and spring break next week for many of the schools, it's important that people remember to continue wearing face masks, try to have all your social activities outdoors, and all the other strategies that we've been recommending for a year. I think everybody knows what these are, but we want to just put out that friendly reminder. It is somewhat safe to gather with others who are fully vaccinated. So that's at least 2 weeks after your second dose, indoors with one another. But we are still recommending that everybody in the community wears masks when they're in public. And if you're merging with other households, to keep your gatherings to outdoors and remembering to stay 6 feet apart. And next slide. All right, so those were all of the big updates that we had for you today. We're here to take questions as well from the media. We want to remind folks that there is our local Blue Ridge Health District hotline. We have experienced quite an increase in call volume over the last week with helping individuals schedule appointments. And we've also changed the options for when you call. So when you call the hotline, if you select option 1, it will bring you to our local hotline. That's the line that can help you schedule an appointment, help you with VAMS issues. We're, of course, continuing to offer testing services and contact tracing all over that hotline. And then also I've listed the website vaccinate.virginia.gov, where we still want people to pre-register in the state system. When you pre-register, that's the way that the health department can get your information to send you an invitation to schedule an appointment. And then also vaccinefinder.org. This is a really great resource for finding vaccine opportunities outside of just the health department. So we encourage individuals to check that as an avenue for where they can also get vaccinated at local pharmacies or other providers in the area. But thank you. And we will open to questions now.
All right, so at this time, we will now invite our credentialed media to ask questions. If you would like to participate in the Q&A, please click the raise hand icon and you'll be called upon in the order of hands raised. After I call on you, you can ask your first question and 1 follow-up question. We will give each media representative 2 opportunities to ask questions in this format. So first up we have is Sean Tubbs. Sean Tubbs, you are on with the Blue Ridge Health District.
Hey there, guys. How's it going today? So I'm a little, something strange just happened. I just got a notification from VAMS at 1:30. I am not in a priority category. I now have an appointment for tomorrow at Fashion Square Mall. How did that happen?
So all of the appointments that we're pulling right now are based off of prioritization in either phase 1A, 1B, or 1C. So it is likely that somehow in the information you shared, you fell into one of those categories. Media do fall into phase 1C. So if you indicated that as an option, that would be why. But we haven't sent it out to everybody just yet that's pre-registered.
Yeah, because I just want to be careful that I don't broadcast this, because I mean, this is a shock to me. I wasn't expecting to get this until June, and suddenly, like, I looked at the screen and it's just, yeah. Anyway, sorry, that's not really a question. It's a little personal, but you answered it anyway. Thank you.
All right, next up we have Rachel Hirschmite. I hope I said that correctly. You can correct me if I did not. Rachel, you are on with the Blue Ridge Health District.
You said it correctly.
Awesome.
So I guess this is related to Sean's question or what, a statement, but so have you been contacting people today in phase 1C to get their shots?
Yes, we launched phase 1C today. So it is very possible that individuals, and hopefully many individuals in 1C, will begin to receive those invitations to schedule an appointment in BAMS.
And when do you think you'll see the day when you can vaccinate 2,000 people a day at the JCPenney location?
Hopefully as early as next week. We have 1,500 doses that we want to administer on Monday. And assuming that we get another bump in Johnson & Johnson, we would love to be able to do that next week. We're just sort of waiting to see what we get for that allocation next week.
Thanks.
All right. So next up we have Jesse Higgins. Jesse Higgins, you are on with the Blue Ridge Health District.
Hey, yeah, so can you Are people in 1C now eligible to go to the pharmacies that are in the federal retail pharmacy program?
That's a great question. I'm going to follow up with you on that. I know that the pharmacies recently moved to open up to all of 1B, and that was a state decision requesting that all of the pharmacies throughout the state. So not every health district has moved to phase 1C yet. So it's possible not all the pharmacies have transitioned to that just yet, but I will follow up with you on double checking.
Okay, great. Thank you.
Thank you.
And last we have Allison Warble. Hi, Allison, you're on with the Blue Ridge Health District.
Hello. I was just wondering, I don't know if this is true or not, but I had heard yesterday that people who were 1C were able to go to Fashion Square and sign up for an appointment at the JCPenney location. And I'm not sure if that was just like a one-off or if you all are taking in-person appointment signups, or if you could talk a little bit about, I guess, what's happening potentially when there are extra openings open on short notice, if that is what happened with that situation.
I'm not aware of anyone in 1C being able to get in yesterday. We had spoken with our team about timeline for opening to 1C. In fact, we were really looking at maybe even tomorrow, but realizing that there are appointments available and now the increase in vaccine, we felt like we could do that a day early. So there should not have been people walking up and getting appointments for 1C. And what we've been trying to do when we realize that maybe we have some doses that we want to administer towards the end of the day and no more appointments are filled, we would go through the list that we have and call down those lists within the group that's eligible for that vaccine. So yesterday it would have been making phone calls to individuals in 1B, but definitely not 1C until today.
Great, thank you.
So next we have Rachel Mahoney. Rachel, you are on with the Blue Ridge Health District.
Hi, thanks guys. I was curious, what has the health district seen so far in terms of people traveling outside of the district to receive a dose, and how has that impacted rollout and phase transition leading up to this?
That's a good question. We have certainly heard of many individuals who have gone outside of the health district to receive a vaccine, and we want people to be vaccinated. At the end of the day, we understand it's hard to be patient and wait for a vaccine. And I know we've said this before, we want shots in arms. So we encourage people to go through different avenues they can to get vaccinated. It's been challenging for us when it comes to second doses, because if someone chooses to go outside of the health district for their first dose, we're not able to provide them with the second dose because our second dose shipment really relies on how many first dose vaccines we administer.
That's good to know. Thank you.
All right, so at this time, we will go into our second round of questions. So if you do have a second question, you can go ahead and raise your hand and we will move on with the Q&A. So right now we just have one, and it's Jesse Higgins.
Hello again. Can you be any more specific as to when all of the 1Cs might expect an email?
So as soon as this afternoon or this morning, we've started to send them out. It takes a little while to get them through the system. So emails have started to go out to the groups and individuals in 1C, and we will continue to send those over the next few days, but they will continue to go through. And we've already done the same for 1B. So while we are expanding to opening 1C, we are continuing to routinely update all of our records for how many individuals in 1A or 1B are pre-registering and sending them routinely new invitations as well.
Okay, that was actually maybe my follow-up question. Like, as the ones that have already registered in 1A and 1B, all of those emails, have they already gone out?
Sorry. all the noises and technology. Yes, so invitations have gone out to thousands of individuals in 1B. Weekly, we upload and send invitations out to individuals in 1A, and we recently sent invites to everybody who was under 1B. And we'll continue to do that as new folks pre-register in the state system, which is where we're pulling the information from.
Thank you very much.
Of course.
Next, we have Allison Warble.
Hi, oh, sorry, I don't know if I was unmuted or not. Kind of a follow-up to what Jesse had just asked too. Do you have specifics about how many people in 1A and 1B have been vaccinated? I feel like I've heard anecdotally from maybe even in Denise and you all a little bit that there are a fairly large amount of people, obviously in 1A with the healthcare systems, the 2 hospitals here, and EMS workers and everyone else in 1A and 1B, and we have a large older population here. Do you all know approximately how many people in those groups you all have either, I guess, vaccinated and or sent notifications out to that they are eligible to sign up through you all?
Well, the numbers for 1A and 1B that have been vaccinated should be reflected in what we shared earlier, because we've only opened up to 1C just today. So those numbers in there, we would assume are the vast majority, 99% or greater, unless someone in 1C slipped through, are the individuals who've gotten vaccinated. I don't know the total number of 1A and 1B that we have, but we feel confident that we're in the home stretch for those 2 groups. Obviously, we'll have new individuals who pre-register based on a new employment opportunity. But I think, you know, that's really the number, the nearly 90,000 people or 89,000 people who have received their first dose, what we'd be pointing to in terms of 1A and 1B who have been vaccinated. We think there's probably about 11,000 in the pre-registration system, but we're not quite sure that number fully reflects those who want to get vaccinated and just haven't gone into the pre-registration system. So it's sort of a moving target when it comes to trying to understand what's still out there in terms of individuals who want to get vaccinated but haven't been able to get to an appointment yet.
Great. And at what point would someone in 1C potentially should they contact you all or seek other opportunities for the vaccine if they haven't gotten a notice yet? I guess, when do you expect to send all of the notices out? Would they be in the next few days, or would it be, should they wait until the end of next week? Or I don't know. I don't want people to start contacting you guys tomorrow just because they didn't get an email today, kind of a thing.
I would say give us a few days. We are working weekends at this point, so we will certainly send invitations out tomorrow and over the weekend as well. So if individuals in 1C don't hear from us, say by mid to late next week, they should email or give us a call and we'll help them schedule an appointment.
Great.
Thanks for clarifying that too.
All right, so last we have Rachel Hirschmite. Oh, I suck at names, guys. I did it right the first time.
It's a hard one. So my question, sorry if you already said this, but how many people in phase 1C are there that are pre-registered that should be getting an email or a call soon? Do you know roughly how many there are?
Ryan,
I think it's about 7,000 based on the pre-registration system. So we can only rely on the data and the information that's provided from that system. So that's roughly the number we've been able to pull from the pre-registration database at the state level. And so there's likely individuals who have yet to pre-register. And it's really important that whether you're in 1C or if you believe you're in phase 2, which is open to all adults 16 and above, that you actually go and pre-register, because that's going to be the way we know that individuals want to get vaccinated and how we would send you the invitation to create the account in VAMS and then schedule an appointment.
And when will all of these people in 1C receive an invitation? Like, what's the latest date that they should receive an email or a call?
We'll be sending out invitations over the next few days. It's as early as today. It depends on when they pre-register. So if they don't pre-register until the end of next week, we will send them an invitation probably the following week. So we'll continue to monitor the system, and we send invites in these batches. We're sending invites immediately so that it's open to everybody in phase 1C, and then we will continue to monitor and send invitations every couple days.
All right, so last hand we have raised is Sean Tubbs. Sean, you are on the Blue Ridge Health District.
Yes, thanks again. Just real quick, this is from somebody who just responded to me. Does 1C include faculty and staff? They didn't see it on your chart. I didn't see it either. I'm still in shock. I have an appointment.
Yes, so 1C includes everybody from media personnel to barbers and hairstylists to restaurant workers, and also higher education professionals like professors at the university or PVCC.
Gotcha. So what would you, so I guess the main takeaway for all of this is to get in the system if you're not already, if you want a vaccine.
Yes, if you want to receive an invitation to be vaccinated at a Blue Ridge Health District site, or we work with the University of Virginia as well for them to help us vaccinate at UVA Health. We encourage everyone to pre-register in the state system. You may qualify for a different phase than what you think. You think you might not be eligible until April, mid-April when we open to phase 2, but you might qualify now. So we want everybody to get pre-registered in the system.
Thanks.
So that is all of the media that had questions. If you want to wrap it up, Kathryn.
Okay, great. Well, thank you all for joining us today. As we've shared, we are officially moving into phase 1B, as we've shared, we're officially moving into phase 1C of our vaccine allocation throughout the Blue Ridge Health District. You can register at vaccinate.virginia.gov to get pre-registered for a vaccine. You will then receive an invitation to schedule an appointment through VAMS, which is our Vaccine Administration Management System, which is how you can schedule your appointment. You can also look for vaccines throughout the community by visiting vaccinefinder.org and calling our hotline. We're always available to assist you as well. And so we thank everybody for your support and your patience through this process. We're really excited to receive an increase in our vaccine supply next week. And we had anticipated it would come in April, and here it is. So it's no April Fool's Day joke. We are excited to have more vaccines, and we will continue to have more and more over the coming weeks. So thank you all.
Thank you.